How long can we preserve these eggs, sir, safely?
We have no data, no information about any limit.
Okay.
Once they are frozen and they are stopped biologically,
Yeah.
we don't have any reference of any limitation. I mean, obviously, you're going to use those oocytes up to 49 years old maximum, because that's the time in which you can be a mother biologically.
Yeah.
So we don't have information about what happens after, I don't know, 40, 50 years, because nobody has used those oocytes or those embryos. But so far, all the information, data, results we have so far, there is no difference in timing. So you can freeze these oocytes or embryos for months or for years, and still they have the same potentiality within.
So what will you do after that, sir, with that embryos?
I mean, that's one of the ethical issues in IVF.
Okay.
We have to produce more embryos than required sometimes, because it's a way to optimize also the cycle. Because if we produce only those ones who are going to be transferred, then we have to do so many cycles, and it's so expensive for the patients. So in one cycle, we try to get as many as possible, oocytes and then embryos. So you have one cycle, one stimulation, you have different chances to get a pregnancy. But sometimes, in some cases, we have extra embryos that are not being utilized. So depending on the regulation, you have different options. If you are not going to use those embryos because you have already, let's say, 2 children, then you are already a bit older, and you don't need to have any other children, you can donate those embryos to other couples in some countries. You can do an embryo donation. You can also donate these for research in different countries, or then you can just discard those embryos.
So we can use these embryos to other clients or other patients, so who are required?
It depends on the regulations,
Okay.
but yeah, it is called embryo donation.
Oh, we can use
so
it.
we can also do that.
Okay.
Yeah.
So in laboratories, how we assess the egg quality, sir?
Again, egg quality has to do basically with 2 parameters for us. One would be the shape of the oocyte. We have different indicators about the shape of the oocyte, but then during the ICSI procedure, when we are injecting those oocytes, we also have information about the resistance of the oocyte, about how they behave when we are injecting, and this information is also very useful. So with all these parameters in the laboratory, we came to know if they are good quality oocytes, if there are any issue, and we have all the information also for the gynecologists and for the patients. So we have information during the procedure, during the womb pickup, when we retrieve the oocytes, during the denudation, when we remove all the granulosa cells, and also during the injection. So we have several points in which we can assess the quality of the oocytes.